Hello, this is Dr. Nancy Trimboli with your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. My hope for you is that with each passing episode, you get closer to being your own best expert. Today, we're doing a Stealth Health Secret Intel Deep Dive. We are on Chapter 4, if you're following along at home. Using medical testing to your advantage. Very often I interact with patients all day long, anywhere from 25 to 50 individual patients, and I've seen patients for 30 years. I'm up to 25,000 individuals. And very often people think, oh, I'm going to go see so-and-so, like they are Jesus Christ Savior themselves, as though this person is going to walk into the room in a golden light and bestow on them every answer that they've ever needed. And unfortunately, medical doctors are, very laser focused on just your problem area. They have very limited tools in their tool bag. So you're not going to get all the answers from them. Let's get that out right now. You are not going to hear about any alternatives. You are not going to hear about nutrition. You are going to hear about a drug or a surgery or a test. So how do you approach medical testing like a boss? Here we go. So I'm going to read a little bit, and of course we'll interject with some commentary. Conventional medicine is part of the system, capital T, capital S. The Latin terms, meaning your diagnosis, unreadable handwriting of a prescription, and the lack of understandable terms move you away from knowledge. And this is on purpose. This is to take away your power, because when you don't understand the verbiage, when you don't understand what's going on with your own body that you spend every single second of every single day with, when you don't understand that, somebody else has to be the shaman. Somebody else has to be the person who's going to tell you what you need to know. And you aren't on a need to know basis, by the way. And they don't want you to do your own research, because then you start asking questions. You're asking questions outside of their realm, because the conventional medical model has turned into an algorithm like we've talked about in previous chapters. If this is happening, then yes. If this, or what's the option? This or this? Yes or no. If yes, this is happening, then this. And then if such and such yes or such and such no, then yes, we go to this. So it is just a flow chart. My goal for you is to put you back into a state of knowledge, of being your own best expert. I say that at the top of the podcast every time. So let's continue. Your opinions have little bearing, right? And you are tricked into thinking you haven't the intellect to understand. I've had more than probably 1,000 patients say this to me when they went to see their medical doctor, and they said, well, what about this? And the medical doctor would say something like, stop using Google. Don't be a Google doctor. Stop reading. I've had patients been told that. You are a peon and a serf, I continue to write in Stealth Health. That's what the system wants you to believe. But you are on a mission. Taking back your knowledge of health and healing gives you the power in your quest to solve Mission U. Mission U is your priority. In Chapter 2, you learned new, better, and powerful questions. What if I could heal? That's the mindset question. Why? Where are my resources? With those, you summon specific answers about your path of healing. This gives you momentum. You are gathering facts, and you have created an arsenal of resources. Knowing that you were previously a pawn in the system gives you a new perspective. You have exposed hidden truths. This new awareness puts control into your hands. You have ammunition. Your perspective now is that doctors, nurses, technicians, and all the support staff work for you. You are not just a side point. You are not a peon. You are not to be spoken to as though you have zero knowledge. You are gaining momentum and you have facts and you have knowledge about you as an individual. Walking into a medical doctor's office with mission you in mind puts you in the stance of data mining. You may humbly realize that you need to gather information from those with greater understanding than you. Or, on the other hand, your ultimate destination of true healing may not include what your medical practitioner has to offer. In this case, you may want to consider the option to use blood tests, blood pressure screenings, MRIs, ultrasound tests, bone density tests, x-ray, and other medical tests to give you information. That's how I want you to think about medical testing. It is just information. You may use these as a starting point, a baseline, or as a way to check progress as you travel along your health path. Like for me, you may know that by following my other content that I do not get mammograms. I do not. But just as a scientist, I know that breast cancer can be caused by radiation and trauma. Okay, what is a mammogram? Radiation and trauma. Okay, I want you part of that. There's also a lot of research that says that mammograms they find too much. They find things that aren't there. They put anxiety and stress into the lives of hundreds of thousands of women because then they need further testing, which is usually even more invasive, like a biopsy. So now more trauma, more damage, and then that unbelievable stress that's associated with waiting for the test date, waiting for the results. So these false positives is what they're called, create a whole cascade of potential injury to the woman involved. Yet it does bring a lot of money into the system. Okay, that's just a side point. Okay, so circling back. So what I did is when I got my very last mammogram, I immediately got an ultrasound test. Now, ultrasound is not the be-all, do-all, but that was my baseline. All my future ultrasounds that I get every couple, 3 years reflect back to the original because we know it's normal. So now my future ultrasounds reflect back to that baseline. I do not get mammograms. I added thermography as another layer of screening, which again is non-invasive, just like an ultrasound test. It is non-invasive and it's just picking up a reading, and now I have a normal baseline of that. So I have been able to eliminate mammograms. Now, if I ever potentially in the future, knock on wood, needed a mammogram in the future, I would get it if it was necessary. But for right now, I have my alternative testing. So I'm still taking care of myself and paying attention. But this is what I mean by creating a baseline. Let's get back to stealth health. Finding alternative ways to heal yourself without medical and pharmaceutical intervention is detrimental to the system, not detrimental to you. Finding alternative ways hurts the system. You have seen others around you whose lives are dictated by medical appointments to the degree where their whole schedule is filled. What a horrible existence, in my opinion. Sometimes they relinquish their ability to choose and just follow doctor's orders without understanding the ramifications, side effects, or outcomes of the recommended treatment, blindly just going along, and then are surprised when they have an adverse effect from a surgery, they have an effect from a pharmaceutical, etc. Their lives are changed, be it forever, because of a surgery gone wrong or a medication perceived to be the only choice. You don't want that for your future. I know you've seen people like this, and you don't want that. On the other side of the spectrum, you see other people making better choices and asking better questions. They're able to free themselves from the burden of health issues. Like them, you feel that medication should only be used on occasion, not as a lifestyle choice. That's what you want for yourself. It doesn't matter if your ultimate goal is to ride your bike when you're 80 or still attend that 10-day yearly fishing trip with the guys in Saskatchewan. You want the freedom and independence to live your life as you wish, not to be tied down with doctor's appointments or a timer to remind you to take the pills. It's not that you are looking for anything grandiose. You live life as you dictate, doing the things you love to do. Losing your ability to make true health choices is linked to losing your inalienable rights as a person. Life, liberty, and the pursuit of happiness. Those are your inalienable rights. And we continue. Now, this is my favorite section, how to approach medical tests like a boss. Thank you to AJ Harper, my editor, for coming up with that subtitle to this section. The way you arrive at your medical doctor's office is important. Put on your flak jacket of knowingness. You know you have an issue. Medical testing may reveal some clues on your healing path. It may not. You are not there for a white slip of paper, although you may accept it graciously, knowing that you may never use the prescription. That is totally fine. And you are not there for useless tests. Useless. We're not there for useless tests. If a test will bring clarity that helps you on the next step to solve mission U, follow the prescribed protocol. Using expertise of someone who can discern test findings and show you the next step would be helpful. You are not looking to be labeled with a dead-end diagnosis. Foremost in your thinking are your three powerful questions. What if I could heal? Why? Where are my resources? Prior to arriving at your appointment with the medical professional, you have outfitted yourself with information that you have procured from other sources. You may have discovered it on your quest while working stealthily undercover, covertly from the internet, from reading and understand a book or a chapter on the subject, or from another health professional. If you should undertake medical testing, it is for one reason. It is to derive information about why this issue is happening to you and postulate answers to what if I could heal. Gathering intel, the 4 medical testing questions. When faced with the recommendations to do medical testing, there are 4 questions you should be asking. Jot down the answers as soon as you are able. So here's your questions, and you can go to my website for a free downloadable page of questions to bring with you on your appointments. And this would be in the resources section of drnancy.health, drnancy.health. Question number 1, and this is what you pose to the medical professional that is recommending the medical testing. If the recommended testing, you could fill in the blank, if this upper GI test results in normal findings, then what's next? Right? If we do this test and it's normal, okay, now what? So options might be further testing, the same treatment as if abnormal tests were obtained, no treatment, merely a wait and see, or a referral to another conventional medical provider. Okay. Question 2. If the results of this test come out abnormal, what does that mean? Now, the possible answers could be the same as question number 1. Options might be, further testing, the same treatment as if the results were normal, no treatment but merely a wait and see, or referral to another conventional medical provider. Let me just interject a side point that I don't think I wrote about in this chapter. Now, in my world, I'm dealing with pain, and typically spinal pain could be radiating to the arms or the legs. It could be numbness, tingling. There could be some muscle loss. Anyway, so one of the common tests suggested is what's called a needle EMG. Needle EMG. And it sounds as bad. It is as bad as it sounds. So they take this needle and I'm holding my fingers about 3 inches apart. Now, I've never had this done, and I've not ever seen it done. But this is what I imagine. Now, it is a needle that they insert into multiple places in your arms or both arms or both legs, one at a time. They stick the needle in, and then they turn up the voltage, and they're looking for, can you feel a tingle? Can you feel a burning pain? And can you feel a sharp pain? Okay, so then they put it in a different spot. And then they put it in a different spot. And it's the same things. Tingle, burning pain, sharp pain. And they work it all the way down your arm, all the way down your leg, and then they switch to the opposite side. It is excruciating. I have had grown men, burly men, strong silent type men, stop the practitioner in the middle of the test and say, I can't do it. I just can't do this anymore. And here's the kicker. The results of that test changed nothing. They changed nothing. So no matter, now the only thing that this test might differentiate, it might differentiate if somebody has a true neurological condition, like a true degenerative multiple sclerosis, something of that sort. If we're just looking at a pain syndrome, a nerve irritation, nerve compression, like somebody that's coming into my office that would do well with chiropractic care, it doesn't change what they're going to recommend. They're either going to recommend physical therapy, surgery, or the pain clinic. Now, a really good doc might say, have you been to your chiropractor lately? If it was a true neurological degenerative disease of the central nerve system, there would be many other signs and symptoms that the patient would be exhibiting. So the needle EMG for my patient base, I tell people, refuse it. You don't need it. Unless I have an inkling. This is 1 out of a 10,000 person case in my scenario. Unless I have an inkling that there's something bigger going on. Something that's outside of my realm. Back to the book. All right. So we're still on question number 2. What if the results of this test come out abnormal? What does that mean? When testing is recommended, it usually means that the outcome will either confirm or rule out a diagnosis. Rule out is a term that means a particular diagnosis is being eliminated based on a test. For example, doing a swab of your throat, a cotton swab of your throat, will either confirm or rule out a strep throat infection. So other questions related to if the results come out abnormal, what does that mean? Other questions would be, what are we looking for and what are we trying to rule out? Note, if the diagnosis or underlying cause or options of treatment do not change based on the results of this test, do not have the test performed. Testing should only be done to discern a path toward treatment or healing. If it does not, it has ceased to be a benefit to you and it only benefits the system. So this needle EMG case is one of those things. That's why I tell my patients, decline that. Because when I know it's a specific nerve coming up from a specific spot in their spine, not an overall degenerative neurological condition, and we know that, if I know that, a spine specialist knows that in the medical realm. So doing that needle EMG, whether it comes out normal or abnormal, has zero relevance on the next step. It does not benefit you. And this may be true of multiple other medical tests that are done. So if the answer to the questions, will it come out normal or will it come out abnormal? If the answer is the same for both questions, don't get the test done. Question number 3. In what way will the results of this medical test direct treatment options for me? And what are the benefits or adverse side effects that can be expected from those treatment options? So, if a drug treatment is recommended, How long will I be on those drugs? Short term or indefinitely? If a surgery or other type of intervention is recommended, what is a recovery time? Can I expect to need another surgery or intervention of this type again in the future? How will my life be changed if I have this done? Would you recommend I get a second opinion? So, this is letting your medical professional know, I'm aware that this medical test may lead to treatments. Okay, what are the options? What am I looking at? The fourth question, how invasive is this test? Are there any dangers to this test? Does a different, less invasive test give me the same or better information? Because you have to realize that some of this testing is dangerous, and it is up to them to let you know what can happen when you take this test. And it is up to you to determine if that's something that's okay with you, or is there another option? Is there a better way for me personally as an individual to find out similar information? So I continue. In the medical system, the primary treatment options are medications. If this is the only reason to have the test done, and you know that you will decline drug therapy, you're going to say, well, I don't want to take drugs. If you know that, it's worthless to have the test done. If you unknowingly accept the testing and subsequent treatment without having a firm idea of the path conventional medicine will offer, you have just submitted to bondage in the system. You have put your wrists out and say, okay, shackle me, put on the handcuffs, I'm yours now. On the other hand, being aware that there are other avenues of healing you could seek in the alternative realm puts you in control. And this is exactly why I do your Healthcare Arsenal podcast, is because we are so indoctrinated into the system, we don't even know that there are people that could help us on our healing path, probably right in our town, in our county, close by. They're here, they're everywhere. We just don't know about them. So I'm here to help you out with that. I continue. The system wants you to be in the cycle of diagnoses or cycle of diagnosis that leads to medication and the side effects, symptoms, or syndromes that lead to a new diagnosis and another medication. It is a rare medical professional that wants to remove drugs from your list, and an extremely rare individual that wants to eliminate the entire list of medications. If you find a medical professional that insists on removing drugs from your life and will assist you in doing so, keep this person close. They are a stealth health ally, and you have elevated and have elevated themselves to you as a resource. Write their name down. We have a journal included with the resources on my website, so you can keep the list of your healthcare arsenal allies close. If you find that you have a good rapport with your conventional medical professional, you might ask, is there an opportunity to use holistic care, a nutritional regimen, or are you aware of any drug-free alternatives? Medical doctors, unfortunately, see the world as it has been taught to them. They are forced into the system similarly to you. Don't fault them for this. It has been ingrained into their procedures, policies, and behavior for decades. Now, I'm not sure if I write about this in this chapter. I don't think so. Medical students, when they're in school, it is so not only emotionally stressful because of the studying and the content of what they need to learn, they are also, there's malnutrition, they lack sleep, and they become, their brains from all these things open up to suggestion. And the suggestions are that holistic doctors are quacks, they have no education, they are hurting people, that their treatments kill people, that it is dangerous, that it is a scam. They are in a vulnerable place because of the the sleeplessness, the poor nutrition, the excess stress, the overwork. This is what happens. This is a big problem with the system in the conventional medical model. I could tell you stories, believe me, about even with the good reputation that I have, about medical doctors still having a disdainful attitude towards anything that's in the holistic realm. And this starts in medical school. They didn't go to medical school like that. It is done to them. We continue. Being part of the corporate medical conglomerate subjects many medical professionals to the stresses of audits, both governmental and corporate, true, quotas to reach or risk having their incomes infringed upon or reduced, and increased patient volume to make up for fees slashed by in-network insurance plans. Medical doctors have agreements with other local medical providers to refer patients back and forth to help each other with quotas. An orthopedist may have a relationship with a rheumatologist, since patients may present to both with similar complaints of joint pain. It gives them an opportunity to create income through multiple office visits and to order medical testing. If you have an opportunity to ask, is there any conservative or holistic avenues that I could or should explore first? Be warned. Once you mention a holistic care paradigm, alarms may start going off in the head of the healthcare professional. They may offer phrases such as, I think there's some good in alternative methods, or say something like, well, my wife is a health nut too, or one of my other patients sees a chiropractor and it seems to benefit them. Or it could be, stop looking things up online, or whatever you see, don't see a chiropractor. It's really going to vary, and you honestly won't know. For as good a rapport you might have with your healthcare or conventional medical professional, you just don't know. There are exceptions to the rules of conventional medical care, and great healers know that there are many methods to healing, not just the tools in their own toolbox. Alternatives within conventional medical care are emerging, with functional medicine being one of them. Okay, 2020 side point here. Now remember, I wrote and finished this book before the COVID craziness. Some of the functional medical doctors that I know during 2020, 2021 especially, abandoned their functional medicine paradigms or ways of thinking because they became targets as being outside of the mantras, being outside of the standard that was being force-fed to us. I don't know if they've gone back to their functional medicine ways of looking at things or not. So you need to take a functional medicine practice with a grain of salt and find out for yourself if they really do look at things from a holistic viewpoint, meaning looking at the whole person, looking at you as an individual, not treating the diagnosis. Let's see. The amount of experience with alternatives is still up to the individual doctor. Not all people and not all doctors work the same. If a medical doctor does tell you to avoid an alternative treatment, ask them if they've had personal experience with it. Not hearsay or stories, but firsthand experience. Boots on the ground experience. And this is true with any realm in life. Like if somebody has an opinion about something, my first question is, what's your evidence to that? And if it's not personal, I ask them, what's your personal experience with that? If they don't have an answer for me, really their opinion doesn't carry much weight with me. Back to the book. Only by being a patient of an alternative healthcare provider can you really understand what it can do. Even if they have experience, and especially if they have none, their opinion is a personal opinion, not a professional opinion. Unless they've earned a chiropractic degree, they cannot say if you are or not a candidate for chiropractic care. Just like a chiropractor cannot look at your teeth and tell if you need braces. So our singular focus is Mission U. And that mission U is paramount. Your singular focus on mission U is to not succumb to the rhetoric of the system. And the rhetoric has become more obvious in the last few years. The system needs you to follow its rules, don't ask too many questions, and for Pete's sake, don't look for additional information on your own. The system doesn't work if you are overtly on a mission. This would turn people off, make them suspicious of you. The conventional medical office staff may label you as a troublemaker if you ask too many questions. The stealth health strategy is to look like you belong, like you are a lemming following all the other lemmings. You may accept a white slip of paper for a drug only if you see this conventional medical office visit is a dead end and you want to exit the office without drawing attention to yourself. At times, we may need to act like we comply with the recommendations just to avoid extra scrutiny, because you know what? The extra scrutiny is a dead end. It doesn't matter what their opinion is at this point. That's why it's called a stealth health mission. Not everybody understands our mission. It's not our place to explain it. Just take the white slip of paper, smile, and retreat back into friendly territory. No matter how open-minded your medical professional, there is an ingrained prejudice to holistic care methods. And this is not new. It goes back actually to ancient Greece. And we are going to leave it with that for today, because that's a whole nother fascinating story that I talk about in Stealth Health. If you've not gotten your copy now, please do. It is available in paperback. It is available as a signed paperback if you get it directly from my office. It is on Kindle and it is on Audible, and I read the book myself. So, as always, my hope for you is that with each passing episode, you get closer to being your own best expert. Bye for now.